You may be watching this because a notification has been made about you. Most practitioners tell us that being the subject of a notification is very distressing and has a significant impact on them. We aren't here to punish practitioners. AHPRA exists to ensure the public is safe. We are always trying to make things better and we welcome your feedback. We hope this video helps you to understand what might happen. Why is AHPRA involved in something like this?
AHPRA and the national boards are required by law to consider any concern brought to us by a person or organisation, no matter how minor it may seem. We do not represent you or the notifier.
We approach all matters with an open mind. We use the concerns the person has brought to us, along with the information that you've provided in your response, to help us understand what has happened and to make a decision about whether there is an ongoing risk to the public.
AHPRA employs registered health practitioners like me who are currently or recently in clinical practice to look at notifications and to help understand what reasonable practice looks like.
We also help to understand the things that can go wrong in healthcare and help distinguish between the minor, reasonable errors and the more serious issues that require action by us.
Does this mean action is likely to be taken?
In over 70% of matters, the board decides there isn't a need to take any action. For example,
we wouldn't normally take action if several different practitioners have provided differing but appropriate advice.
Also, we would not normally take action where a practitioner has provided care of a reasonable standard, even though it was disappointing for the patient.
On the other hand, your board is likely to consider taking action when a practitioner's clinical knowledge or skills are significantly lacking, or if there is a number of complaints about a person indicating a significant underlying problem with their practice.
What kind of action does the board usually take?
When action is taken, it's often a caution, like a reminder that your board wants you to reflect on.
Sometimes it's a requirement to do more training or education.
Am I going to lose my registration?
It should be reassuring to know that less than 1% of all notifications end with cancellation or suspension of a practitioner's registration.
Will I be able to keep working?
Normally you'll be able to continue working while we assess concerns. This is usually true even if we decide to investigate.
In a very small number of cases, the board may take immediate action to suspend or limit your registration if required. We will always speak to you first about this.
Who needs to know about this?
We would encourage you and all practitioners to contact your professional indemnity provider because they have a lot of experience in these things. That's why you have insurance. They will be able to advise whether you need to contact anyone else. Your professional associations may also be able to provide advice and support.
We as AHPRA are required by law to advise your employer only when there is action taken by your board. We will only tell your employer about decisions affecting your practice and will not disclose any personal health information unless you give your consent to do so.
Are practitioners involved in the decision making?
A practitioner from your profession will see your notification early on and be involved with decisions along the way.
Your board is the decision maker in matters that come to AHPRA. Your board includes both practitioners from your profession and members of the community.
AHPRA also employs health practitioners like me to help understand the concerns that are raised.
How long will this take?
Almost half of all notifications are closed within 3 months. About 1 in 5 matters are complex and can take more than a year to complete.
We are working hard to speed up our investigations, and each year they're getting faster.
Is this on my record forever? What will appear on my record?
A caution or decision to take no further action is not publicly recorded, but we usually have to inform the person who raised the concern with us about the outcome.
The only things that will appear on the public register are a restriction on your registration or a decision by the tribunal, which only occurs in a very small proportion of cases.
How common is this? How many notifications do you get?
AHPRA receives thousands of notifications a year.
Across their career, many practitioners will receive a notification.
Most of them go on to continue their practice without ever receiving another one.
What should I do now?
Contact your professional indemnity provider or your professional association. They have a lot of experience and can provide a lot of useful support and advice.
Other services are available to support your health and well-being. You are also most welcome to contact your AHPRA case officer if you have any questions.
Remember, receiving a notification is not uncommon. It's also not a sign that you're a poor practitioner, and it doesn't mean that AHPRA or your board doubts your ability. Practitioners tell us that it's helpful to have support from friends, family, colleagues, and other sources when going through a notification. We encourage you to get the help and support you need. If you still have questions, please call your case officer or visit our website.